When pelvic health issues arise, the common medical reflex is to assume the muscles are weak, leading to the near-universal recommendation of Kegel exercises. For millions, these muscles exist in a state of severe, unbroken tension, much like carrying your shoulders shrugged up to your ears all day without realizing it. This is a hypertonic pelvic floor. Here, the muscles at the base of the pelvis remain constantly active, contracted, and shortened, even when the body is otherwise at rest. Normally, these muscles act as a dynamic support system, resting at the bottom of the pelvic cavity in a downward curving bowl shape. Chronic hypertonicity forces this group to draw upward, locking the pelvic floor into a rigid, flattened plate. Because these muscles sit at the absolute crossroads of the human body, a single point of locked tension creates a physical blast radius that impacts every neighboring system. This central location makes the pelvic floor a mechanical epicenter, where a single point of tension can disrupt the function of multiple surrounding systems. The immediate consequences of this tension are most visible in the two systems sitting directly against the pelvic floor, the bladder and the bowel. When the pelvic floor becomes a rigid plate, it compresses the urinary system. This upward pressure creates constant urgency and makes emptying the bladder painful or incomplete. That same tension acts as a roadblock for the digestive tract, restricting the complete evacuation of waste. This chronic contraction also chokes off local blood flow to the area. Without proper circulation, the surrounding tissue struggles to heal, often resulting in recurring hemorrhoids and anal fissures. These chronic lower pelvic blockages are frequently the result of a purely mechanical restriction, a healthy digestive system being obstructed by an inflexible muscle. Beyond digestion and waste, a hypertonic resting state alters the function of the reproductive system, fundamentally changing the experience of intimacy. Because the pelvic opening is held in a state of constant contraction, penetration of any kind, whether during a gynecological exam or sexual activity, often becomes physically impossible or severely painful. This tension also reaches the local sensory network, specifically impacting the pudendal nerve and its branches. These sensory nerves weave directly through the pelvic floor. When the muscles turn rigid, they act like a vice, clamping down on the passing nerves. This compression triggers sharp, radiating pain and neuralgia throughout the vulva, vestibule, and broader pelvic region. These sharp, localized pains are often neurological misfires directly triggered by the muscular vice. Panning out to the skeletal system reveals the pelvic floor's role as the foundational base of the body's deep core. These muscles do not float. They attach directly to multiple anchor points across the bony structure of the pelvis. Hypertonic muscles behave like over-tightened cables. They exert a constant inward tug on the surrounding skeleton. This structural tug-of-war frequently manifests as unresolving lower back pain, SI joint issues, tailbone pain, and hip dysfunction. However, most orthopedic diagnostics completely overlook this connection. A therapist treating a tight hip or a sore back may never think to assess the resting state of the pelvic floor. Many cases of stubborn lower body joint pain are actually core muscle issues masquerading as skeletal problems. While these 5 categories, bladder, bowel, sexual, neurological, and orthopedic, seem disparate, they share a common physical intersection. In a clinical setting, patients rarely present with just one of these issues. Instead, they often struggle with a cluster of symptoms from 2 or 4 of these categories simultaneously. Because the root cause is muscular overactivity, traditional advice to strengthen, contract, or perform Kegels can actively worsen the condition. The effective treatment protocol requires the opposite approach. These muscles must be trained to surrender and return to their relaxed baseline. Treating these symptoms in isolation often fails because the underlying muscle tension remains unaddressed. For those identifying with this web of overlapping symptoms, the path forward involves partnering with a specialized pelvic physical therapist to assess the resting state of these muscles. Healing from these systemic issues requires moving beyond traditional ideas of tension or strength, focusing instead on the physiological process of letting go.